Firstly, I would like to acknowledge the traditional custodians of the lands on which we sit. I sit on the land of the Gadigal people of the Eora Nation. I pay my respects to elders past, present, and emerging. Welcome to webinar 32 of the Impact 2020 series, hosted by the Centre for Social Impact. Centre for Social Impact is a collaboration of across three universities: the University of New South Wales in Sydney, University of Western Australia in Perth, and Swinburne University in Melbourne. The discussion today focuses on social impact assessment in times of crisis, and uses the case study of the evaluation of Your Job, Your Way. And if we could have the next slide, please. The evaluation of Your Job, Your Way, a long-term youth unemployment, a pilot project looking at addressing long-term youth unemployment. The evaluation is a collaboration between the Centre for Social Impact and Your Town. Your Town, previously known as Boys Town, who is also implementing the program. While the research team across the two organizations is a bit larger, today you will hear from three of us. Myself, Ioana Ramia, I am a research fellow and lecturer at the Centre for Social Impact. I am an evaluation expert. I support government departments, not-for-profit and for-profit organizations to measure the social impact of their programs, initiatives, and policies. My colleague, Dr. Ariela Melter, is a research fellow at the Centre for Social Impact and has experience in complex qualitative research and working with vulnerable groups. From Your Town, Brendan Burke is the head of client services and manages the Your Town decentralized service delivery network across 5 states and all of the Your Town helpline services. Now I will hand over to my colleague Ariela, who will give us some background on, will introduce you to the problem of youth unemployment and introduce more widely the project.
Thanks, Ioana. I'd also like to start by acknowledging that I'm on Cammeraygal country today, and I'd like to pay my respects to elders past and present of this land that I live on and am now working on, and extend that respect to other Aboriginal and Torres Strait Islanders who are here in the webinar today. The program that we've been evaluating and which we'll talk about today is one to address long-term youth unemployment. This is an issue that many of you are probably familiar with, and much of the background that I'm about to talk about may be familiar to you as well. Youth unemployment is unfortunately a huge issue in Australia. It was even before COVID started, and it's only extended to become even worse since the virus crisis. In December 2019, youth unemployment was double the rate of the general population. So 11.5% of young people were unemployed compared to 5.1% of the population more generally. This was and continues to be a really huge problem as unemployment has a huge range of very serious consequences for young people. Social consequences, economic consequences, health consequences. And we don't want those affecting young people at an early stage of their lives. Under COVID, the youth unemployment situation has unfortunately worsened further. The general population unemployment rate has extended to 6.2%, and for young people, it's now 13.8%. Again, a larger jump for young people than for the rest of the population. Those stats are from April. Young people are, in general, likely to be hard hit by the impact of COVID, and we're seeing it happen as they commonly work in consumer-facing roles, for example, retail, hospitality, and also have high rates of casual employment. So they have a more uneven level of support through some of the current schemes like JobKeeper, because it depends how long they've been working for their employer. The main scheme to assist in addressing unemployment in Australia is Jobactive. Jobactive is an initiative by the Australian Government to connect job seekers with employers, and it's delivered by 1,700 providers around Australia. It's intended to help people who are clients of Centrelink to search for work and build their career profile and skills so that they can find employment. Importantly, it's based on a mutual obligations framework where people using Jobactive need to attend a certain number of job interviews, apply for a certain number of jobs, and attend training as a requirement of the program. There have been a lot of long-term frustrations with the approach and effectiveness of Jobactive. This actually led to an inquiry into it, which reported in December 2019. The inquiry found that Jobactive was not fit for purpose and not delivering its stated objectives. The reporting stated that Jobactive was assessing people as job ready without actually providing the support they needed to back them up in a more holistic sense, support them in the other areas of their lives that affect their employment. It also said that the mutual obligations requirements didn't necessarily result in quality or realistic applications for work for many people. That many of the compliance arrangements, the report said, were unfair and punitive, and that the funding model of Jobactive was found to incentivise providers to churn people through short-term work rather than helping them find long-term sustainable jobs. In the context of youth unemployment, which I spoke about earlier, all of this doesn't bode particularly well for young people who are using Jobactive, especially where some young people may need more intensive support than other job seekers to get established at a really early stage of their working lives. So it was as a result of these long-term frustrations with Jobactive that service provider Your Town has been running a pilot of an alternative program, particularly for long-term unemployed young people, which is called Your Job, Your Way. Your Job, Your Way is a program that uses a more targeted, more intensive and more client-centered approach. Overall, what this means is that the program can provide a more holistic type of support for young people than under Jobactive. It's a 24-month program which has been running since mid-2018 and is due to wrap up mid-2020, so pretty soon. It's run in 3 locations around Australia where Your Town provides Jobactive services already. And notably, these are each locations that experience particular disadvantage. The 3 locations in question are Elizabeth, Caboolture and Burnie Devonport. This is the program that we've been evaluating and that we were halfway through evaluating when the COVID pandemic hit. That's some really important background for everything else we're going to talk about today. I'm now going to hand over to Ioana, who's going to talk about the program and the evaluation of it in a bit more depth.
Thank you, Ariella. So I'll start with the Your Job, Your Way theory of change because the conceptual model of the program is essentially different from other programs that were designed to address long-term youth unemployment. So Your Job, Your Way supports young people aged 15 to 21 and 15 to 24 in one of the sites who are long-term unemployed, which means that they were unemployed for 52 weeks or more, through a targeted, intensive, and client-centered model of support. So what does this mean? It means that there are 2 designated Your Town staff members, the Pathways Coach and Employment Mentor, who meet regularly with the young person and work closely with them to address various issues, which we will discuss. But these 2 staff members, we'll refer to them as Your Town staff, the Employment Mentor and Pathways Coach. They work with a much lower caseload than that of Jobactive staff, which is about, they work with about 25 young people compared to 65 in Jobactive. And this allows for more interaction with the young person. So the model is based on one-on-one client-centered vocational and non-vocational support. They engage closely with the young people to develop a detailed job plan. And they also engage with employers. They support the young person in job search, and then through post-employment through a post-employment plan, with a purpose to improve the well-being and access to work for young people and for them to maintain their work. And under this umbrella of what the program wants to see being achieved for young people, is included both vocational and non-vocational outcomes. Non-vocational outcomes such as, for example, improved physical and mental health, and then outcomes that refer to being job ready and then attaining and maintaining the job, such as improved awareness of opportunities, increased job specific skills, and then becoming employed and going into long-term sustainable employment. There are a few enablers that are usually mapped in a theory of change. Those are the elements that support the program. In our case, the potential employers, because in certain communities, there is a little bit of a stigma around the long-term unemployed youth. So there needs to be a little bit of engagement with the employers to ensure that they come on board of the program. There are supportive services, there are Your Town partnerships, community acceptance, and the family interaction that all contribute to the way that young people engage with the program and the way the program is being delivered. If we could go to the next slide, please. So for the evaluation of the program, the Center for Social Impact engaged with, partnered with Your Job, Your Way for the evaluation quite early on, since Your Town was planning the program, the pilot program, which was a wonderful moment to start engaging for an evaluation, because as we all know, evaluations are best when they're planned from the beginning, because you can address so much more and you can plan all the data collection. And the purpose of the evaluation was to inform service improvement, strategy and design, as well as to provide evidence-based to advocate for more intensive client-focused response to long-term youth unemployment. So we landed on 3 types of evaluation. Process evaluation, to understand how the program was established and implemented. Outcomes evaluation, to understand what the program achieved and for whom. And economic evaluation, and where we assess the cost of the program relative to its benefits, and both are expressed in monetary terms. For this evaluation, we developed a range of questions. So a number of questions fitting under each type of evaluation. And we have a number of data sources that will support us to answer these evaluation questions. Some evaluation questions are answered, for example, by using data from a couple of sources, such as, for example, the second question there, what have been the challenges and successes in implementing Your Job, Your Way, which is a question that fits under process evaluation. So to understand this, we'll be talking to service providers, and we'll have that information from interviews with them, but also from service providers' observation. And then there are other questions, for example, what are the outcomes that are being achieved? So maybe the 5th question from the bottom, are the intended Your Job, Your Way outcomes being achieved, and for whom? Where we'll be gathering data to answer this question from a number of sources, for example, from young people in interviews, but also from client record data analysis, which is more administrative type of data, but also we'll be talking to employers, because some of the outcomes are for those employers. So a range of data sources are used to answer various evaluation questions. If we could go to the next slide, please. We've already conducted the interim evaluation, which covered the period starting July 2018 and ending in June 2019, so the first year of the pilot program. And there is also were quite pleasing. So we found that there were successes in both vocational and non-vocational outcomes. So there were indications that the young people had improved health and well-being. They improved their confidence, motivation, independence, and they were also getting prepared for work. They had greater job search skills, and they had better workplace and social skills. In terms of the purely vocational outcomes, we found that a greater proportion of young people were placed in a job compared to Jobactive. And also one of the measures of success are the conversion rates, which are the proportion of placements that are converted to 12 weeks outcomes, which is the proportion of young people that get a job and maintain their job for 12 weeks. And the proportion of people who go past the 12-week point in their jobs and continue to go on to remain employed for at least 26 weeks. And we found that compared to Jobactive, young people in Your Job Your Way had a greater success rate. So it was all positive preliminary findings in the interim evaluation, and then we started collecting the data for the final evaluation, and that was we already passed some point August, September 2019. And a few things have happened, and I'll pass on now to Brendan to explain to us what happened then.
Thank you, Alana. Just an explanation on this slide. The definition of contingency in relation to this is the government relaxing mutual obligation requirements for people on income support. I guess what that means, as an organisation, the traditional mutual obligation requirements for young people on income support is that they must apply for a minimum number of jobs per week. They must turn up at appointments, and there can be financial penalties imposed on their income support if they don't adhere to these mutual obligations. As an organisation, we're not very much supportive of overly taxing compliance and mutual obligation requirements, but there are some advantages. You know, we certainly believe that if you are on government income support, there must be some obligation to engage with agencies that can help you get a job. And our motivation in relation to mutual obligation is to have that engagement and be another avenue to help young people find work. So as you can see from the timeline, we had a terrible summer and you know, some catastrophic results in some regions around the bushfires. But for a period of time, all mutual obligation requirements were relaxed by government. And sometimes when that happens, the messaging gets a bit confused as well. And sometimes the messaging is not that you don't have to engage or go in to engage with your employment services provider, but you shouldn't do it. And for a period of time there during the bushfire crisis, it was very difficult to engage with our client group. And consequently, even as the bushfire situation was easing, there are a number of regions that were significantly impacted. One of those regions, the Northern Adelaide region, continued to have the bushfire contingency for a period of time, where we've got one of the pilot areas for Your Job, Your Way. But then, of course, came along COVID-19, and once again, the contingency application, was applied, and mutual obligation requirements were once again relaxed. And this was then for an extended period and nationally. And that, of course, continued some of the difficulties or issues or challenges that we had to face. I'll just go on to the next slide, which can talk a little bit about that. In a way, there was no other choice but to deliver the services and retain the engagement virtually. You know, everybody, certainly unemployed, people in jobs, we've got the government message: stay at home, you know, socially distance. And in those early days of COVID-19, I know things are easing a bit now, and we've still got to be vigilant. But you know, the messaging was very much, you know, don't go out to public, don't go into public spaces. So people were staying at home. All of our sites certainly stayed open. because we wanted to be there for young people in crisis. But by far and away, the majority of the services were delivered virtually. This was mostly by phone, SMS, and email. We did a number of, we've certainly learnt as an organisation, as I think a lot of organisations have in the human services and other sectors, you know, to engage with people by Zoom and CoView and other modalities now, which I think will probably put us in good stead going forward to make sure that we're providing the service in the most appropriate way to young people. But this program relied heavily upon that face-to-face engagement, and there was an initial period of disengagement until new routines were eventually established. But we had to consider it wasn't only the young people impacted. You know, we certainly had staff in high-risk groups, and we were trying to maintain a very safe work environment for our staff as well. So there was certainly a period that was unsettled until we could establish these new routines. The other impact, of course, was job vacancies and job placements dried up immediately, dried up straight away. You know, the labour market, industry, employers, that they didn't know what was ahead, and job vacancies slowed or stopped overnight. We are now beginning to show signs of recovery, but I'll talk a little bit later about there's far more increased competition and barriers for young people to take advantage of this slow signs, these initial signs of recovery, which I think will impact youth unemployment for a long time going forward. So as restrictions are being lifted, certainly most of our staff have returned to sites, and the sites, like I said, have stayed open during the whole period. Face-to-face engagement is slowly returning. However, we are now certainly looking at a combination of virtual and face-to-face options going forward. Thanks. Next screen, thanks.
Yeah, so when the crisis started, so around February, March, we realized that surely, you know, we need to understand how this is affecting our evaluation. So the first thing for us as evaluators to understand was the extent to which the program delivery has changed during the crisis. So that's when, so Brendan has talked about most of that, but this is what has been on our mind. So how has the program delivery changed? Because this will make a difference to the evaluation. You know, thinking generally, if activities are not delivered as you intend, then you might have to reconsider what outcomes you want to measure, because some outcomes may purely not be achieved because some activities didn't happen. So first we need to understand how has program delivery changed. Then we knew that we need to find a way to differentiate between the effect of the program and that of the crisis. And then the bigger picture of the evaluation, we knew that we were in a situation where access to participants would have changed because of the social distancing, and that we would have to reconsider our data collection processes and how we engage in data collection with each group of participants. So these have been the things that have made us well, at least these are the aspects that we had to reconsider or just think about in the context of the crisis for our evaluation. So as Brendan discussed a little bit this about the impact on the program delivery, I'll go on with the impact on part of the data collection, which is the administrative data or the survey data collection. So the administrative data, the quantitative data that we collected, the plan was to collect intake data and then follow up at review time. So that's 6 to 18 months of being in the program. So at intake, we collected data from from all participants on various demographics and things that we wanted to know about the young person as they entered the program. But it also included some measures of their well-being, such as Kessler score and K10 and the personal well-being index. So for these two measures, we planned to collect this information repeatedly at 6 and 18 months, 24 months, depending on their review periods. This data was essential and is essential to capture the long-term change, because improved, as you would have seen, you saw on the previous slides on the theory of change, improved well-being was one of the major, of the most important outcomes that were listed in the theory of change. Then what happened during COVID-19? So that was our data collection plan. During COVID-19, we had to shift all this data collection to online. Well, it was, before it was done online, but it was done when the person was visiting the site. So this is something that I omitted to say, but it's there in the second dot point. So when the young person was visiting the Your Job, Your Way sites, they were there with their, or with Your Job, Your Way staff, and they were filling the data online, getting that support from the staff member in case they didn't understand the question or they had literacy problems, which might have been the case with quite a few young people. So they, once everything was moved to being done over the phone, that is the review time, then the young person couldn't receive that in-person support, face-to-face support with filling in the online information. So the change was that they would still fill in the survey online while being supported over the phone by the staff member. However, there might be the problem of some young people not having internet access or having data allowance problems, in which case the proposed solution here was for the staff member to fill in the survey for the young person while being on the phone. So they would ask, you know, how they would answer each of those questions, and the young person would inform them over the phone, and the staff member would fill in the questionnaire for them. And also this would be collected from young people who haven't had their review. So only some of the young people would fit into this group, as some would have had their review prior, you know, sometime between December and March when we brought in this new data collection approach. What was new here also was the inclusion of some COVID-19 related question, how the pandemic has affected the young person and their ability to engage with young people, with Your Job, Your Way. Now, the problem of some young people having already filled in the survey before, or having done their review before, was that probably only a quarter of the total young people would have a review during the period starting from March, which out of the total, this is something that we haven't mentioned so far. So at the interim report, we had about 128 young people in the program. So if you take about a quarter of that, we are looking somewhere around maybe 30 young people having their review after March. So this would mean that we would only get this additional COVID-19 information from about 30 young people, and we'll see how that becomes or may not become a problem. So if we go to the next slide, based on this plan on how we will collect the data, our way forward has been the response rate, and we were quite pleasantly surprised that the response rate has not changed much and might remain quite high, because young people, even though the mode of collection has changed to being over the phone with the staff while filling in the survey online, young people remain quite engaged, which was an early indication that, or another indication that the Your Job, Your Way approach to connect with the young person is efficient, and they remain engaged before the data collection and not only. We thought that respondents might not answer truthfully if the staff was filling in for them over the phone, and this was an option that we didn't quite like as much. But we found that firstly, from the intake data, we asked young people whether they had issues with their internet access or data allowance, and most of them said that that was not a problem. So that was the first indication that most of the young people would be able to fill in this survey. And so far, the reports are coming back that from staff that young people are able to fill in online, and they haven't needed to fill in over the phone for their for them. And a way to go around it, we also agreed that this the young people that are cannot fill in the survey online and they are filling it over the phone with the staff member, are being flagged in the data so that we can look at potentially any biases in having, responding to the survey via the staff member. The COVID-19 related questions to differentiate between the effect of the pandemic and that of the program, we included them as optional because we were aware that it might be a little bit of a risk tiring out the respondents and also tapping into, an area that it might not be so comfortable to talk about. But again, we were pleasantly surprised that young people actually prefer to discuss what happened to them in that period and to answer this additional survey questions. I think I'll pass on now to Ariella to talk about the qualitative data collection, what has changed and what has been our way forward.
Thanks, Ioana. So aside from the administrative data that Ioana was talking about, the other big component of the data collection for us was a large longitudinal qualitative component. Young people had the opportunity to be interviewed for the evaluation 3 to 4 times over the course of the whole piece of research, depending, and whether it was 3 or 4 times depended on when they joined the program. At the stage where COVID hit and we were thinking about implications for fieldwork, young people were due for a final round of longitudinal interviews for the evaluation. So it was either their 3rd or 4th interview. However, this raised some pretty significant questions for us to think about, because for us, young people were in Your Job Your Way precisely because they were disadvantaged and experiencing long-term unemployment. And the big question for us was, what did this then mean for moving their interviews to a remote option, either phone or online? We would never normally do anything other than face-to-face interviews for people who are disadvantaged. But in this situation, that just wasn't possible, and we had to decide on the way forward. It raised a whole bunch of questions for us. Some of those were practical questions about practical questions and risks. So, for example, would young people have access to phones and video platforms to do interviews through? Many of the data allowance questions that Ioana spoke about earlier also applied here. And the key was that we were planning the evaluation approach quite early in the piece after COVID hit, and we hadn't seen the evidence yet of what the answer to this question was, whether young people would have data problems or not. There was also a period of time while we were planning where we didn't know whether young people would still be engaged with Your Job Your Way if the mutual obligations requirements were paused. Brendan also spoke about that earlier. And the implication for us was, what would the response rate be like? Would there still be people there who wanted to be interviewed for the study? There were also some ethical questions and risks. So, for example, if we weren't doing face-to-face interviews as we would normally do, how could we make sure that we adequately and safely protected from distress in the interviews when we're at a distance? If we weren't face-to-face with young people, if we were over the phone, would we be able to sense when the interview wasn't working for them and we needed to take a break or stop? There was also a question at one stage in planning the qualitative fieldwork about whether the context had changed in terms of who it was even appropriate to ask to be interviewed. This was early in the piece of COVID. We didn't know how bad it was going to be in Australia, and we were worried that there might be some people who were so severely affected that actually it wouldn't even be appropriate to approach them about participating. And we needed to toss that up with, our usual concerns of allowing young people the autonomy and decision-making to make their own choices about taking part. Finally, a last question for us was what the best, meaning the safest and methodologically useful way to ask questions was. These were all things we considered. The way forward that we settled on was interesting. I'm going to talk about a number of aspects that we decided on. And I guess the important point is that we were informed by the work of the researchers who had done the previous rounds of data collection on the ground, and that was really important. Jennifer Moffat from your town had some really excellent experience and insights into how the fieldwork would work based on the interviews she'd done in the previous round and thinking about what the implications were going forward. So one of the things that we decided on was that we just needed to accept that the response rate and sample size were going to be smaller this time. It was unfortunate and it was unavoidable, but we needed to carry on with the evaluation regardless and acknowledge any sample problems in the final reporting. It wouldn't necessarily be the top thing on people's radar to participate right at this moment. Secondly, we decided that we needed to consult with the service providers on the ground to match our data collection practice to how they were implementing service provision. So as Brendan spoke about earlier, what transpired in the 3 sites where Your Job, Your Way was being provided was that in the end, phone calls and text messaging were 2 of the really effective ways of providing services to people from a distance. So we modelled our interviews and fieldwork based on that. Drawing on the experience in the sites, drawing on the local expertise of the service providers was a really important precedent for us as researchers in making the fieldwork work and doing something that young people would be comfortable with. Thirdly, we knew that we needed to trust in the relationships developed through a longitudinal study. We were quite lucky in this evaluation that most of the young people were in their 3rd or 4th interview for the study and had done a face-to-face interview for the evaluation in the past. The researchers from your town who were doing the interviews this time had all done face-to-face interviews with the young people before. And so drawing on that experience when they then spoke to them, this time by phone, meant that there was also already a bit of relationship and rapport built, which really helped our fieldwork and probably the response rate this time round. Admittedly, this would have been harder if we'd been starting an evaluation from scratch during this period and didn't have that longitudinal precedent to draw on. We decided that we needed to seek advice from service providers about who to ask to participate while still trusting in young people to have their own autonomy and make their own decisions about taking part. We included an extra question at the point of starting up the round of interviews about if there was anyone who really wasn't appropriate to approach right now, but overall gave young people in the main the decision to participate as their own choice. Incidentally, there was no one who the service providers said wasn't appropriate to approach. The final aspect to our data collection, which is always something that we work with, but was even more important now, was asking questions in a flexible manner, using the strength of the qualitative approach. Being nimble and compassionate in the way you ask questions, responding to the way people act in the interviews and their tone is really important always, but it's even more important now when asking questions in what is for many a distressing moment. The fieldwork is just finishing up. It's not quite done yet. So I can't report on exact numbers of people who've participated, but the report so far is that there's been really good engagement from young people with the interviews, and that phone interviews have worked quite well for them. Young people have reported some impact from COVID on them, but not as high or perhaps as negative as maybe we feared. Most have still received really good support from Your Job, Your Way, just in a different format from before. So the phone, the text messages, the emails that Brendan mentioned. Young people have also reported some benefits for them in terms of stress and mental health, of the relaxing of the mutual obligations requirements, which probably isn't a surprise to anyone, but it's a nice thing to be able to capture in the data in terms of informing the service system moving forward. I'm now going to hand back over to Wana, who's going to make some final comments on impact evaluation in times of crisis. And then we're going to end on Brendan talking about the importance of the evaluation for your town, particularly at the current moment.
So what does all this mean to impact evaluation in times of crisis? Well, here are our learnings that we're passing on to you now. So you need to understand what changed in how the program was delivered. You need to explore alternative approaches to data collection and what that means to the quality of data and the evaluation. You need to evidence what changed in how data was collected. So you need to keep a really good track on how the data collection has changed, because if, for example, someone does an interview in person or over the phone, probably there are different aspects that could be considered there. Same if someone fills in a survey in person or over the phone. So you need to evidence all your changes. And then finally, you need to consider the context when analyzing the data. What else might have changed that could affect the program outcomes? Because like everything else, a program doesn't exist in a cocoon. It's not isolated, and especially in the condition of crisis, there are various things that might interfere. So you need to keep an eye for what else might be influencing these outcomes. So how it worked for us, we understood, it was great that we could understand the strengths and the weaknesses of our respondents. So we really built on what Ariela also just mentioned, that good relationship with between staff and respondents. So through that longitudinal data collection, but also through the relationship between the Pathways Coach and Employment Mentor and the young people, because even the data collection mode changed, the young people remained engaged. We drew on your town's capacity to shift services and data collection. So this was a great help to continuing the evaluation. We could engage with the service provider to understand who can continue to engage in the evaluation. We had initial fears that some people might be distressed by the evaluation, so we had to measure up to see, well, are some young people who could really be harmed by continuing this evaluation? And then we asked the questions flexibly in both the quantitative and qualitative data collection, what Ariela mentioned, and also in the survey, offering the option to fill in how they felt and how COVID-19 has impacted them, but also giving them the option to not answer. I'll now pass on to Brendan to talk about what this meant for your town.
Thanks, Alana. I just want to confirm, I suppose, your Job Your Way model was a result of a lot of research we did into long-term youth unemployment. We asked a lot of young people, we spoke to a lot of employers and service providers, and we did a lot of literature research. And this dual worker, low caseload, individualised, high-intensive model came about because we believe it's unacceptable to have 50,000 young people long-term unemployed in Australia. So we were prepared to invest in it. So we invested in setting up the pilots at Caboolture in Queensland and Elizabeth in Northern Adelaide. We mounted an argument to government, and we were able to get complementary funding to run a regional pilot in Burnie, Devonport through Try, Test and Learn through Department of Social Services. We don't only want to impact youth long-term unemployment by reducing it and by preventing it going forward, but we also want to advocate and evidence the need for systemic change rather than short-term investment and short-term impact in the delivery of employment services. Government has done a lot of long-term metrics around the cost of doing nothing around young people that are on youth allowance now. And if you can make that stronger investment up front, you can save community, government, so as well as getting great social and economic outcomes for young kids, you can save community and government going forward. And that's one of the things we're hoping to achieve. The global financial crisis showed us that young people are the slowest to recover in terms of being left unemployed. What happens is there's less entry-level jobs available. There's more casualisation as employers want to build up slowly. There's far more competition for jobs. It's not far-fetched to say young people will be competing against pilots out there for entry-level jobs. There's the mental health components, and we know the linkage between mental health, unemployment, suicide. And the fact now that older people won't be retiring as earlier, and they'll be competing against an older workforce staying in the workforce. We know all of these things happen. So we're committed to Your Job, Your Way. It was mentioned at the start that the pilot program, the research component finishes in June. As an organisation, we're committed to continuing the delivery of it, to keep working with those long-term unemployed young people that are in the program, and to continue evidencing and advocating for change going forward. But we need to act now with that group of young people that are long-term unemployed, and we have to act strongly to prevent young people entering long-term unemployment. And also government has come on board by extending the Try, Test and Learn pilot for a period of time in Burnie, Devonport as well. Not that, the job market's not looking great, but we want to focus on individuals, needs, wants, aspirations, look at what opportunities there could be going forward, look at what education and training we can give young people in both soft skills, vocational skills, to prepare them for job opportunities going forward. We want to continue to work with employers in the communities we're in to understand their needs, their wants, their social commitment to finding young people jobs. And we want to work collaboratively with local service providers. So, yes, thank you. I believe this is the last slide before questions and answers, but I hope that sums up the importance of the evaluation to us here at Your Town. Thanks, Awana and Aretha.
Yeah, thank you, Brendan. So we'll move on now quickly to Q&A, and I have looked a little bit. I've looked a little bit at the chat. I also want to say hello to John Galvish from Your Town. He's the research lead from the lead of the program from Your Town. And I see he's answered a couple of questions in the chat. I will, there was a question on whether we had ethics approval to collect data on the personal well-being index and the K10 score. Yes, the data collection, all data collection for Your Job, Your Way has had ethics approvals from UNSW, from the UNSW Ethics Committee. There was a question from Chris. So I'm traveling from the top. Did we get an indication of the extent to which successful participants in this program displaced your young people competing for jobs through general Jobactive organizations? Well, we wouldn't be able to know. So if we look at the proportion of young people in each, so if we take some initial measures of success, the proportion of young people in the program who have been placed in jobs, and we compared that of Your Job, Your Way with that of Jobactive. And then the conversion rate, so how many actually maintained their jobs for 12 weeks and then 26 weeks. If we look at the success rate, we can say for each group how successful they were to maintain those jobs. So it wouldn't really be a question of some group of young people displacing the other, because they would have all had access to the same type of jobs, but it might be then just a matter of being placed in a job that they actually maintain. So it more talks about once placed in a job without that competition and fight for the job, whether they have the capacity to maintain the job. So those indicators of success don't really talk about one group displacing the other. I'm not sure if Brendan wants to add anything onto that, or for that matter, John.
Awana, just a quick one. The employment services market only, not all employers use the employment services market. And in Your Job, Your Way, it's about working with the individual to prepare them for jobs that are available out there. So there's a lot more jobs out there, or there were, and there still is within recessions. That's the thing. You've got to be optimistic. There are still jobs, happening within recession. But the idea is to work with those Your Job, Your Way participants so that we can get them ready for jobs that are not necessarily advertised within the job market or employment services market. So yeah, I agree with you. It's definitely not displacing. We're working hard on that particular group.
There is also the next question, do most youth unemployment initiatives focus on matching people to existing job opportunities or also on job creation, such as entrepreneurial opportunities? Is one more efficient than other? Would you like to answer this, Brendan, as well?
Yeah, sure. Look, if the young person, if we can work with the young person and achieve that, well and good. But it's similar to the previous question. What we're really working on is that young individual's aspirations, needs, wants, strengths, and trying to prepare them for opportunities. Now, whether they're opportunities that are advertised or whether they're opportunities that we go and proactively approach employers and find out what's out there that meets this young person's aspiration, needs and wants. So, yeah, it's similar to the last question.
Yeah, and the next question is also quite similar as well, saying, did we use a baseline of young people staying in a job or a more nuanced scale of appropriate jobs?
What we did, we tried to, we took a complete cross-section of people that were young people that were in the Jobactive caseload. So there was questions there about gender and levels of disadvantage. So our smaller caseloads in Your Job, Your Way mirrored our long-term unemployed caseloads within Jobactive. So so that we were able to do, I guess, comparisons with like to like in terms of performance. And so far, the results within the interim evaluation and moving towards the final, pre-COVID, you know, are very, very encouraging with what we're achieving in Your Job, Your Way.
The next question from Francesca was about what the general message about doing evaluation in times of crisis. And I think I covered this right after the question was posted, but it was continued on with the question, did you incentivize young people to engage in the evaluation, and were the funding body happy with this approach? I think we did offer young people an incentive to participating in evaluation in the shape of a voucher, like a movie voucher or Calls Maya voucher for participating in the research, which is quite is the general standard and has been for such research and has been approved by the ethics committee at UNSW. Traveling through the questions, any young people from a cold background involved in the program? I believe that we have about 11% of our sample were from a cold background, at least for the interim evaluation.
Yes.
I've got some questions, Awana. I can maybe help out here.
Yeah. Sorry, I'm traveling through the chat.
Yeah, it is hard. So Kelly has asked if the evaluation will be made public, and if so, when are you expecting it to be completed?
So we are now collecting the data, and data collection with the program. The pilot program ends in June 2020, and we're likely to analyze and finalize the data and finalize the reports by August, September 2020. I don't think we've decided on a launch date or a time when it's being publicly made, or maybe Brendan or John want to add anything on this?
Yeah, I wonder, John Dalgleish, Head of Strategy and Research. We do intend to make the report public because we believe that there are some great learnings here for the sector and policymakers. And we're talking to the funding body for the evaluation, which is Macquarie Foundation, to do a launch sometime after the report's available in November.
All right, thank you.
Another question from Aurora. She's wondering if you're able to comment on any changes observed in the K10 and PWI measures over time.
Not yet. This data hasn't been included in the interim report yet, so we wouldn't be able to make a commentary on that just yet. But it will be available in the final evaluation report.
Okay. Maybe just one more question, because then we'll need to wrap up. From Susan, are you also able to advise any gender differences in impact and outcomes?
We do have demographic information on all participants. So if this hasn't been, outcomes haven't been analyzed by gender so far, but it's an aspect that we may consider for the final evaluation.
Great, thanks. I just realised my video wasn't on. Is there anything else you'd like to wrap up with, Awana, Ariella, or Brendan?
Oh, it's Brendan here, Rhonda. Just a question there from Gillian very quickly about levels of disadvantage of participants. As I mentioned, we took a straight cross-section of long-term unemployed young people. And I think even from the interim evaluation and what will come out is, you know, if you've been out of work for longer than 12 months, there's all those kind of issues about, you know, lower education levels, increasing mental health issues, and a range of issues there. So it's just a straight cross section of long-term unemployed young people and the issues that come with it.
Thank you, Brendan. Ariella, Awana?
I think the other thing to add to that is people experience different issues related to disadvantage. So the interim report showed that, you know, some of the issues that people were dealing with that they needed to address before they could really improve vocational outcomes were things like housing, things like being limited in not having access to public transport and not having access to a driver's license. So in a more qualitative sense, there were quite a range of aspects of disadvantage beyond a simple measure of how disadvantaged people were that played into their vocational outcomes. And the important thing from the perspective of this evaluation is that Your Job, Your Way is a flexible and holistic enough program that those non-vocational areas were able to be addressed by the program to help people improve their vocational outcomes as well.
And I would like to add a final remark, but more from an evaluation perspective. Firstly, on the importance of being engaged from the very beginning of a program and its evaluation, and planning the evaluation from the very beginning when the program is being planned. This has proven to be a massive advantage for the evaluation at all its stages, at all stages, but especially when we turn to the period of crisis. And second, that in a period of crisis, you know, we shouldn't be scared to do an evaluation, but to just look for the opportunity there and use all the levers to, you know, to improve the evaluation and to perhaps collect even richer data if it's allowed.
Great, thank you so much to all three of you. A few people are commenting to say thank you, and the presentation was really thorough, which I absolutely agree with. So thanks to all three of you for being here and sharing your knowledge and expertise. And thanks to all of our attendees as well. We really appreciate you getting along to an Impact 2020 webinar. We just have a few more left. We've been running for 6 weeks. Our last one is this Friday, the 5th of June. Check out impact2020.online for more info. If your question didn't get answered today, when I send the survey email tomorrow, feel free to respond back to me and I'll make sure Awana and Ariella get it and we can get in touch with you. Thanks again, everyone. Hope you have a great afternoon. See you later. Bye.